Hello, and welcome to our webinar, a crash course for care partners, how to help people receiving LSVT LOUD and LSVT BIG. My name is Beth Peterson. I'm a speech language pathologist and one of the LSVT LOUD training and certification faculty instructors, and I'll be one of the presenters here tonight. I'm joined by my colleague, Laura Gousset, and she's a physical therapist, and she's one of the LSVT BIG faculty instructors and also the Chief Clinical Officer for LSVT BIG. We're both very excited to be here tonight or today, depending on where you're located, presenting on this important topic on how to help care partners help those receiving LSVT LOUD and LSVT BIG. So I'm going to just quickly go over the plan for the webinar so that you know what to expect. First, I'll cover some logistics, and then Laura and I will do a presentation of the content that we've prepared for you. And then we'll have some time at the end to address any questions that you have. And then at the very end, as soon as you log out of the webinar or just click X to log out, there'll be a brief survey that will pop up. So we would appreciate it if you have a few minutes to take that survey. It really helps us to improve our webinars and make sure that we're presenting content that's relevant to our audience. So first, I'll just start with some logistics. Right now, everyone in the audience, your microphone is automatically muted, and that's just to make sure that we don't have background noise or feedback from the various environments where you're joining us. But if you do have a question at any time during the webinar, and this is the same way that you can ask at the end of the webinar, you can either raise your hand on the webinar control panel, and then we'll see that you have a question, and I can call out your first and last name to let you know that I'm unmuting your microphone, and you can ask your question out loud to the group, or you can type in the chat box, or I'm sorry, the question box on your webinar control panel, and then I'll see the text of your question, and I'll ask your question out loud, and either myself or Laura will answer it. And you can also always email us, and we'll put the email address up at the end, but it's info as in information, so info@lsvtglobal.com. I also wanted to mention that you should have received an email, I think it went out a few hours ago, with the handout for today's webinar. If you didn't receive that email or you weren't able to get the handout, it's also attached in the webinar control panel. You can see it in the handouts tab. So you can download that for your reference and either print it to have during the webinar today or just for your reference later. I wanted to mention that we will play a video in this webinar. The video will only play audio if you're connected to the audio through your computer speakers. So if you've called into the webinar and you're listening on your phone audio, you won't be able to hear the audio during the video. You should be able to see it, but you won't be able to hear it. So if you did want to log out and then log on to a computer, that way you'll be able to watch the video, you'll be able to see and hear it. If you aren't able to do that, there are some subtitles in the video, so it will help you follow along with what's going on in the video. And also you can always watch the recorded version later if you do want to see that video. It will be in the second half of the webinar, so you have some time before that comes up. And so I think that covers the logistics for today. So I'm going to go ahead and move on to our next slide. This is the biographies for myself and Laura, so I won't go into depth here, but it just gives you some more background information about our backgrounds. And then in terms of disclosures, so all LSVT faculty, myself and Laura included, have both financial and non-financial relationships with LSVT Global. The non-financial relationships include a preference for LSVT LOUD and LSVT BIG as treatment techniques. And the financial relationships for us include that we're employees of LSVT Global, and we also receive lecture honorarium and travel reimbursement. For reporting continuing education activity, this webinar is not ASHA or state registered for continuing education units or CEUs, but it may be used for self-reported CEU credit. So if you are a speech therapist, physical or occupational therapist, and you want to self-report your activity, just email us after the webinar. It's webinars@lsvtglobal.com, and we can send a certificate to you so that you have that for your records. So licensing requirements do differ by state, so check with your licensing board to determine if they do accept non-ASHA registered or non-pre-approved CEU activities. And attendance for the full hour is required to earn a certificate. So I want to go over the learning objectives so that you know what to expect here today. So at the end of the webinar, we hope that participants will be able to identify 2 non-motor symptoms that contribute to softer voices and smaller movements in people with Parkinson's. And you may see this referred to as PWP throughout the webinar, so people with Parkinson's. We want you to be able to discuss the elements of the LSVT protocols, so for both LSVT LOUD and LSVT BIG. Identify at least 3 tips to help optimize success for your person with Parkinson's during LSVT treatment. Discuss the importance of homework during and then also after treatment concludes, and how you can help your person with Parkinson's with their homework. And then at the very end, we'll discuss some ideas to help you avoid care partner burnout. So you may notice through the objectives, and you should have seen this in some of the emails, that the webinar today is geared towards individuals with Parkinson's and their care partners. If others are joining us, that is perfectly fine. Just to give you a heads up of who this webinar is more directed to, and kind of how we'll be speaking tonight during the webinar. So with that in mind, we do want to see who is joining us so that we can get a sense of who our audience is. So I'm going to display a poll on your screen in just a minute, and if you can just let us know if you're a person with Parkinson's, a family member, friend, or care partner, a physical or occupational therapist or assistant, including students, or a speech therapist or an assistant, including students, or if you fall in another category. So let me pull up that poll. Okay, so you should see it on your screen there, and if you don't mind just taking a minute to click on what's appropriate for you. Okay, so it looks like most people have selected there, so I'll just share those results. So most people on the webinar today are family members, friends, or care partners of those with Parkinson's, but we do have a variety here in the audience today. So welcome, we're glad that you're all here joining us for this important topic today. So I'm just going to do a breakdown of our top tips so that you can see how the webinar is organized today. First, we're going to start by helping you understand some of the key motor and non-motor symptoms that are common in Parkinson's disease so that you can see what types of things are contributing to the deficits for individuals with Parkinson's that does make it harder to speak louder and move bigger. Specifically for the non-motor symptoms, we'll talk about the sensory deficit and the internal cueing deficit. We'll then talk about what the LSVT programs entail. Then we'll give some general tips from LSVT clinicians for both LSVT LOUD and LSVT BIG on how you can help. And then we'll talk about success through homework, so both during treatment and beyond. And then at the end, we'll talk about some care partner resources to make sure that you are also avoiding care partner burnout. So we'll talk about some of the symptoms in Parkinson's. It's both a motor disorder and a non-motor disorder. So it's important to understand the motor symptoms of Parkinson's so that you can see what's going on and how much effort it takes to override some of these motor symptoms that are occurring. So there's rigidity, there's often a tremor, bradykinesia, which is slowness of movement, hypokinesia, which is small or underscaled movement. So in terms of voice and communication, this can result in a quieter, flatter voice. In terms of movement, it can result in overall smaller movement. So a smaller arm swing, smaller stride or gait length, smaller finger movements in the fine motor tasks, harder time reaching. And these can become more severe as Parkinson's progresses. So with these in mind, you can think about that it takes a lot of effort on the patient's part to override these motor symptoms of Parkinson's and scale up to normal. So they're starting at this smaller or slower movement for both, again, the voice and the body movements. So with these programs, we're scaling them up to normal, but it takes a lot of effort just to get up to that normal level. So Parkinson's is not just a motor disorder, and if we only focused on the motor part of the disorder, we would not be successful with treatment. So it's also important to understand some of the non-motor symptoms of Parkinson's that can get in the way of being successful so that we can also target that through treatment. So we have a whole webinar on non-motor Parkinson's symptoms, so we would encourage you to watch that if you're interested in learning more about that, and you can find that on our website. But today I'm just going to highlight a couple of them that we'll focus on in the webinar today. And so those are highlighted in the blue font. So the first one is internal cueing. And so there's an internal cueing deficit that we're seeing with Parkinson's. So it's difficult for a person with Parkinson's to know to initiate the movement or initiate the louder voice, but they can, with an external cue, get louder or move bigger. So there's an internal cueing deficit. There's also sensory changes. So there's a difficulty with the self-perception and self-monitoring. And so we have some slides on this, but just an example would be an individual with Parkinson's might not realize they're too soft. And if they're asked to get louder and they bring their voice to normal loudness, it feels like shouting to them. So there's a difficulty with that self-perception of their loudness and monitoring their own loudness. The same thing happens with the body movements. So at the bottom of the slide here, you can see a summary. Motor and non-motor symptoms can negatively impact speech, voice, swallowing, communication, mobility, balance, and activities of daily living in people with Parkinson's. So again, through the treatments, we're focusing on both the motor and non-motor Parkinson's symptoms. So we'll break down those non-motor symptoms just a bit, the two that I mentioned. So the first is that sensory disorder and that scaled down output. So this is how it may manifest in individuals with Parkinson's. With posture, you may see a patient maybe leaning or falling, and they may be unaware that this is occurring. With their gait or their walking, so the patient may think they're walking faster than they are, or they may think that other people have just started walking faster, and it's not them that slowed down or that has reduced stride length, but others are just starting to walk faster now. They may be unaware of their reduction in their arm swing. In terms of speech, the patient often denies being reduced in loudness, and they think everybody around them needs a hearing aid. They didn't get softer, everybody's hearing has just gone downhill. So those are some of the results of the sensory disorder that occurs with Parkinson's. So when they're asked to move bigger, it feels too big. It feels funny to them. And when asked to speak louder, it can feel like they're shouting. So you can imagine if you were an individual with Parkinson's and you're asked to move bigger, you would feel funny and you wouldn't be comfortable doing that. It takes a lot of effort to override those smaller movements and that feeling of feeling like you're moving overly big or that you're shouting and people are going to look at you funny because you're shouting, when really we're just bringing individuals up to within normal limits. So for both the within normal limits movements in LSVT BIG and within normal limits loudness for LSVT LOUD. So with internal cueing, so again, I mentioned that there is an internal cueing deficit with Parkinson's, and Parkinson's results in a disruption of the internal cue or the trigger for movement. So again, patients are not able to self-initiate. These deficits in self-initiated movements are due to underactivation in an area of the brain called the supplementary motor area. So patients can get louder or move bigger with an external cue. So one example I remember all the way back in grad school when I was working with my first individual with Parkinson's, someone showed me if you put an external cue like the individual's cane or something in front of their foot, that was an external cue for them to take a larger step. So they weren't able to take that larger step on their own, but they could with the external cue. The same thing with loudness. We see very often, even in the assessment for speech, when we ask a patient to get louder or we model loudness, they can very easily get louder, but it takes us to provide that external cue in the beginning. So through treatment, we're targeting that difficulty, that external or internal cueing deficit, so that by the end of treatment, patients don't need that external cue anymore to move bigger or get louder. So we're retraining that internal cue for them. So you can imagine it's not easy. So what you can do as a care partner is, again, learn about these sensory deficits to understand what's going on. You can experience what it feels like to talk too loud and move too big. So often with my patients, I will talk to family members and let them know what's going on with a sensory deficit and have them feel like they're shouting or moving too big. So it's important to understand that internal cueing deficit and also appreciate the effort required to move bigger or talk louder in Parkinson's. So an example we do is we'll say, okay, I want you to tell me, hello, Beth, but I want you to shout it to me. And then they'll say, hello, Beth, then they'll shout, and I'll say, okay, now I want you to do that all day long, every single day. They'll say, well, I can't do that. I can't walk around shouting. It's so much effort. People will think I'm crazy. And I'll say, well, that's how your individual with Parkinson's feels all the time, because they're starting at a voice that's too soft. We're bumping them up to that within normal limits loudness level, but to them it feels like shouting. So you can imagine how much effort it takes just to get to within normal limits loudness. So it's important for family members to understand that as well. In terms of the big side, so you may notice this is the pink panther on the slide here. And so we always tell a story about a clinician who was working with a patient in LSVT BIG, and they were working on their bigger movements, and she had said, what do you do when you want to walk big? And the patient said, oh, I do my Pink Panther walk. And I don't know if you remember the Pink Panther, but the Pink Panther has really exaggerated kind of arm swing and stride length, so really big movements. So the clinician said, okay, go ahead and walk like the Pink Panther. And this patient walked with just normal stride length, normal arm swing, but to them it felt like they were so exaggerated, they were like the Pink Panther. So at home, you can try to walk like the Pink Panther and feel how much effort it is, and then imagine if you were asked to do that, not just during your therapy session, but the expectation is that you're doing that all the time. It takes a lot of effort to move bigger and talk louder for your individual with Parkinson's. So it's important to just be educated on these, be aware of what's going on, and we'll talk about this throughout the webinar, but just have patience because the person, your loved one, or the person you're caring for is really working very hard, and there's a lot of effort needed to override these sensory deficits and the internal cueing deficits. So we want to just briefly mention what the LSVT programs entail so you can see how the motor and non-motor symptoms are targeted. The protocols are based on 30 years of federally funded research and clinical experience. So LSVT LOUD is the speech therapy, and LSVT BIG is the physical or occupational therapy. And both of these are delivered by clinicians who have gone through a training and certification workshop in order to be able to do the treatment. So both programs, they're structured, they're evidence-based, so that means they're based on research. They're rehabilitative treatment protocols developed specifically for Parkinson's, but we've now seen through research can also be used for some other neurological conditions. They adhere to principles of motor learning and activity-dependent neuroplasticity. So that neuroplasticity means changes in the brain. It's intensive and challenging exercise. So they really are exercise programs, but they're specific to the unique features of Parkinson's. So we talked about some of those. Specifically that hypokinesia, bradykinesia on the motor side, and then also specifically tailored to those non-motor symptoms as well. They're personalized and specific functional training of the voice, mobility, and activities of daily living. So intensive training and practice is key to motor learning and neuroplasticity. So if we want to make the changes that are going to last not only just for the month of treatment, but also over time, then that intensive training is very important. So we have intensity both across and within sessions. Across sessions, we have treatment that's delivered 4 consecutive days a week for 4 weeks. On top of that, we have daily homework practice. So that's all 30 days of the month, not just the 16 days of treatment. As part of homework, there's also daily carryover exercises, which is a chance for the patient to take their loud voice or their bigger movements and use it in something that they're doing during that day. That's also all 30 days of the month. And with this, we're developing a lifelong habit of practice. Just like if you ran and you trained for a marathon and you did great and you could run forever, if you stopped running, then you would have to build back up again to get to the shape that you were in when you were there to run that marathon. So just like any other type of exercise, you need to get in a lifelong habit of practice in order to develop and maintain the gains in both the voice improvement and the body movements improvement. So there's also intensive training within sessions. So within sessions, we're pushing our patients to high effort levels. We're doing that through increasing the amplitude, multiple repetitions, force and resistance, accuracy of the target, so making sure the patients are doing the exercises correctly, and working our patients to a healthy fatigue. So what does the research say about intensity? That intensive practice is important for maximal plasticity. So the maximal changes in the brain that accompany the changes that you see behaviorally in that improved voice and body movement. So that intensive effort is needed to override the bradykinesia and hypokinesia, some of those motor symptoms that we talked about that contribute to the difficulty with movement and speaking. So this is a breakdown of the LSVT LOUD treatment session. The first half of every session is composed of daily exercises, and that includes maximum duration of sustained vowel phonation or long loud ahs. Then we have a maximal fundamental frequency range. So then patients work to go to their highest ah and their lowest ah. We do 15 repetitions of that. And then what we call maximum functional speech loudness or functional phrases. And these are 10 phrases that patients say every day in their daily living. So they'll also practice those in their loud voice during treatment. That takes up the first half or the first 30 minutes of the session. The second half are the hierarchy exercises. And these are structured reading and spontaneous speaking activities that build in complexity across the weeks of treatment. So in week 1, we're working on words and phrases using that loud voice. Then we progress to sentence level reading, so usually 1 to 3 sentences using a loud voice. Then in week 3, we get to continuous reading in the loud voice. And by week 4, the goal is that we can work all the way through conversation so that by the end of treatment, every single thing the patient is saying is said in their loud voice. Homework again is assigned all 30 days. It includes both the daily exercises and the hierarchy exercises. And the carryover exercises are also assigned all 30 days of the month. So the first daily exercise is the first half of treatment. Those we call the core amplitude rescaling exercises. And the second half is translating that amplitude or that increased loud voice to functional, salient, and individualized goals for each patient. And then we also have what we call calibration training. So that's addressing the mismatch between one's perception of their vocal loudness and how others perceive it. So that sensory deficit that we were talking about, individuals with Parkinson's may not realize that they're too soft, and then when they're asked to get louder, even though we're just bringing them up to normal loudness, it feels like they're shouting. So we calibrate them. We have to retrain that sensory perception. So by the end of treatment, they'll use the loud voice in daily living. And that's the goal. So we have those treatment exercises, we have the ahs, we have the high and low ahs, but it wouldn't do no good if a patient could do great with their ahs and highs and lows, but then they couldn't go out and order at a restaurant, because you certainly can't order by just saying ah. So the end treatment goal is that the patient has a louder voice in everyday conversation. Okay, so I'm going to turn it over to Laura, and she's going to go ahead and introduce you to the LSVT BIG protocol.
Hi, everyone, and thank you, Beth. So if you're a caregiver joining us today, I think it's really important that you know what's expected during an LSVT BIG treatment session that the person with Parkinson's or other condition will be going through within an hour. This is set up in a way that's very parallel to the LSVT LOUD treatment session, although it's a completely separate 1-month protocol. LSVT BIG was developed from LSVT LOUD, and that's why it is so similar, because we know that the structure and framework of it is very effective. So on the left side, you see maximal daily exercises, and there's 7 different exercises that the individual will work on large amplitude movements using the whole body. So there are some that are done in sitting, there are some where they're stepping in different directions, and then there are a couple of rocking exercises. And it should be noted that these are adaptable for all levels. So for individuals that are unsafe in standing, we can adapt them to a seated or a lying down position. And for people that are really high functioning, we can make them more challenging as well. So that's kind of the first part of the session. And then the next thing we typically do is called the functional component tasks, which you'll see on the top of the right-hand column. These are very simple motoric activities that are functional based and important to the client. So they're not complex. You can see some examples here are very simple movements like going from sitting to standing, pulling keys out of a pocket, using cell phone. And these are an attempt to begin to help the individual integrate these bigger movements into daily life. So we practice these very repetitively over the course of 1 month. Next, the individual will participate in what's called hierarchy exercises. So we spend a great deal of time interviewing the person, the patient, to identify what are the things that they really maybe are struggling with as a result of Parkinson's disease, or what are the things that they really love doing that they want to continue doing despite the progressive nature of Parkinson's disease. And our goal is to help that individual use larger amplitude, more normal amplitude throughout that activity, and learn how to do that over the course of a month of treatment. Within every session, we have walking big. That could be short distances for people that maybe just live in an apartment or a skilled nursing facility. It could be very long distances for people who are out and about in the community, perhaps still working, exercising, etc. And then everyone gets homework exercise. So same thing, go ahead and click through it, Beth. If you see on the left side, these are kind of our core building blocks of better movement. And on the right, then we work on translation of those larger amplitude movements into functional tasks, which are individualized and important to each person. And just as with LSVT LOUD, we have calibration training in LSVT BIG as well. Beth mentioned that to the person with Parkinson's, it often feels like they're shouting when in fact they're talking in a normal voice. We see the same sensory deficit with movement. So when we first help people walk and move in a more normal amplitude that looks fantastic to the rest of the world, and you as a caregiver might saying, wow, you know, I haven't seen you walk like that in years. And you're saying, bravo, why don't you do that all the time? Internally, it feels giant to them, just like Beth said with that Pink Panther example. So they might think, you know, I can't walk like this. People will think I'm crazy. Takes a lot of training, a lot of feedback, a lot of reassurance and practice to perform what we call recalibration or calibration training to address that mismatch between how they perceive their movement and how others perceive it. So on the next slide, you'll see that although we might be practicing, you know, large amplitude exercises such as this rocking one where you can see her doing a weight shift and reaching up really high, our goal is not to be masters at the exercises. Our goal is to learn how that feels, to learn how to generate that bigger movement so that they can then use it in function. So when our client goes home, we can say, hey, did you feel that big reach that we practiced with the rock and reach exercise? I want you to use that same effort, use that same big reach when you try to get stuff off of your top bookshelf or out of the top cupboard in your kitchen. And when the person with PD really recognizes that, wow, that really helped, that's a great sign that, you know, there's going to be carryover into daily life. So if you're interested in one of these treatments and you're not really familiar with how to find a clinician and how to, you know, really determine how to find the right clinician, if there's an interview process that we always ask, you can go to our website and there's an orange button at the top that says find a clinician where you can search for one based on your geographical area. And then you might find a whole bunch of them in the area and wonder, gosh, where do I even start with this? You can narrow down by practice setting, and once you do, you can simply contact them by email or by phone and ask them these 4 key questions that are really, really important to make sure that you will be receiving the gold standard protocol, whether it's LSVT LOUD or LSVT BIG. And those questions are, do you deliver it per protocol? And that means they're delivering at a dosage of 4 days a week for 4 weeks. They're individualized 60-minute sessions, so that it's never a group treatment. And the patient will be assigned daily homework and carryover assignments. You might also ask how many clients they've treated. However, someone seeing their very first client should be competent and able to, you know, do a good job, but it's nice to know if someone has some experience so that you can ask, what are your typical outcomes that you've been seeing? And hopefully they'll say something very positive, like I've had great success with this program and here's what I've typically seen. And then you want to say, do you have a follow-up or maintenance plan? We know that Parkinson's in particular is a chronic condition, and this is a really key part of the treatment, is that you want someone that's going to be a long-term partner with you and not just a partner for this 1 month. So if you receive, information back from the clinician after you contact them that says that they're doing something different, and you can go to the next slide, Beth, in terms of the dosage, maybe they're only doing twice a week or 45-minute sessions, or they only do a few of the exercises, or, if it's anything different than that protocol that we have described, it's not actually LSVT BIG or LSVT LOUD, because there are no modified versions. It's either, do the true protocol or offer a different treatment. And we feel very strongly about this because of the 30+ years of research that validates that these treatments are efficacious for people with Parkinson's disease. So if you get some answers of modified sessions or treatments, just say thank you and move on to the next person if they're not able to offer it per protocol at that time. And we hope that you have great success in finding someone. And certainly if you don't, you can always contact us and we can help you. So on the next slide, let's take a look at how can care partners help during and after LSVT LOUD and LSVT BIG treatment, because that's really the heart of our webinar today. So we're going to highlight both some tips from clinicians and from people with Parkinson's and from ourselves as well. So let's start with clinicians. So we took some informal surveys of clinicians that are LSVT LOUD and LSVT BIG clinicians. And the first thing they said is be sure and use positive words and experiences. They understand how, frustrating it can be to kind of be a broken record and say the same things over and over again, or say things like, I can never hear you, or you're, walking in a shuffling pattern again, or something like that. But better to do is focus on when they get it right. So, that small time when your loved one says something in a nice loud voice or moves really well, say, wow, I can hear you. That voice sounds great. You're walking right next to me and not behind you. And those positive reinforcements can really be helpful with people with Parkinson's disease. You can also help to facilitate positive interactions beyond yourself. So in other words, set up scenarios that that they can use their louder voice in bigger movements, such as phone calls, Zoom sessions, in-person get-togethers, so that other people can also have the opportunity to say, wow, Bob, I haven't heard you talk that well in a long time. You sound great. I don't have to ask you to repeat yourself anymore. So on the next slide, one of the other things they said is really be empowering. Oftentimes, if Parkinson's disease has been present for a long time, maybe the deficits have gotten more severe where, it just is very inefficient for the person to, for example, get dressed by themselves or do something by themselves, and the caregiver has gotten used to just jumping in and doing it for them. However, when they go through the LSVT treatments, they are going to be empowered to begin to do those things on their own again. So maybe classically you've helped them to get out of bed or get out of a chair, but now the therapist is actually working on those tasks so that the person can do them more independently. It might be second nature to jump back in and say, oh, I'm going to help you up, but step back, let them try it first. Cue them to use their big movements or their louder voice if they need to, but give them some time to try it, problem solve through it, and hopefully succeed at it as well. There might be things that the person with Parkinson's has stopped doing after Parkinson's disease, like answering phone calls, writing thank you notes. Maybe they stopped helping with household chores that they used to. Those would be a great thing to bring up to say, I remember you used to do all the dishes, or you used to take care of vacuuming, or you used to be the one to answer the phone. You're doing so much better with your movement now and with your voice. I'm going to let you do those things some more, again, if you'd like to. That's very empowering for them. So stop doing everything for them, even if it takes more time or is more efficient for you to do it yourself. And I know that can be difficult, but an important thing to do for empowerment. On the next slide, we'll see that the next tips we're learning about how to be a good coach. Now, not everyone with Parkinson's going through the LSVT programs need coaching. Our goal is that they can be as independent as possible with their exercises. However, some people do need it because of memory or cognitive issues. Some people need a coach at home more for safety issues. If you've been asked by the therapist if you can be a coach and you're able and willing to do so, it's really important that you observe a therapy session or two, or maybe many, so that you can better understand the exercises, learn the exercises, get feedback from the therapist. Hey, am I doing these correctly? And how do I cue them for the patient? Towards the end of the 4 weeks, you might even ask if you can lead a portion of the session to make sure that you're providing correct feedback and cueing, that you're doing it right, so you can be the best coach possible. You can always speak to the clinician in the middle of those 4 months or those 4 weeks of treatment to see not only how they're doing, but to share with the clinician what you see at home in terms of the patient's progress and carryover of bigger voice and bigger movements at home. So have patience, be empathetic. You know, this is a very effective treatment, but it does take time. It's not an overnight improvements. It's gradually over time, and your role in that is really important. On the next slide, we'll see a few other communication-specific tips from LSVT LOUD certified clinicians. They suggest that really thinking about optimizing the environment for success with communication. So reminding the person to speak face-to-face, to look at each other in the eye when communicating, so that you can see, you know, mouth movement, facial expression as well, and it puts the head in better position. If there's background noise, such as TV or radio or things like that, turn that down for better success at communication. And you might also choose to sit like in restaurants in quieter areas where it's less crowded for more effective communication as well. On the next slide, I'm going to share with you some insights from people with Parkinson's disease. So several years ago, we did a survey of caregivers and people with Parkinson's of what do you want to know and what do you want your loved one to know, whether you're the person with Parkinson's or whether you're the caregiver. And these were insights that were provided from people with Parkinson's. I just shared a few, but we heard these, you know, over and over from many individuals. First, just be empathetic. It's hard and it's frustrating. Be patient. Encouragement is the best gift. This person had a very wonderful wife, and he said, my wife is very knowledgeable and supportive. She adds new exercises to our ever-expanding mix, and rather than getting discouraged, she incorporates new lessons without complaint, making it easier for me to remain committed to my exercises. Encourage me to do it at home, do it with me, time me, give out encouraging words. As a physical therapist myself, I can't tell you the number of times where I've had a spouse that comes back to treatment with the patient and says, you know, I've been doing the exercises right along with Larry, and they're great for me too. They're helping my balance and they're helping my posture. So sometimes they're just great exercises to do, even if your loved one does not need a coach. The caveat for that is always make sure that you're safe to exercise yourself, right? All right, so on the next slide, let's begin to talk a little bit about homework. Homework is really, really critical, not only during the 1 month of treatment, but beyond. And we're very forthright with our clients that are thinking about doing LSVT LOUD and LSVT BIG to let them know that, yes, you're going to make huge gains during the 1 month of treatment, but the only way that you'll successfully maintain that is to get in a habit of doing your exercises every day, kind of for the rest of your life. There are different ways that we support people in doing their exercises, such as the homework helper videos. So we have videos of both the LSVT LOUD and LSVT BIG exercises that can be purchased in DVD. They can be downloaded or streamed through Vimeo. We have something called the LSVT Companion, which is a computer software device to walk you through your LSVT LOUD homework. And if you're interested in this, we did put the link here to our store, and we'd be happy to share a 25% off code with you if you're interested in that. After LSVT Loud and LSVT Big, you can also see if there's a Loud for Life or a Big for Life class in your community. This is a group exercise class intended for graduates of LSVT Loud and LSVT Big, and I'll talk about that in a future slide coming up. Then your therapist will say, you know what, just like you go to the dentist every 6 months, you're going to come back and see me every 6 months or so for a tune-up to make sure that you're still talking loud and moving well. And it might be a short dose of treatment. It's usually not the full 16 again, but just to keep you maintained with your function as much as possible. And lastly, your therapist, especially your physical therapist, might say, hey, here's some other opportunities for exercise in your community that I think you should check out. So let's go to the next slide. Beth is going to play a video, and this video is from our Homework Helper LSVT Big DVD Volume 2, the seated and supine adaptations. And this is kind of a long video. It's 6 minutes, but I think you'll love it because it really reinforces some of these caregiver tips that we have talked about in the previous slides.
This chapter will review some general tips for care partners, but we recognize that every person is different. Please always consult with the LSVT Big certified clinician for tips and recommendations specific to you and to the individual you are helping. Your role as a care partner of someone with Parkinson's is valuable. If you have the opportunity, please consult with the LSVT Big therapist for specific recommendations. Practice the exercises with this LSVT Big Homework Helper video on your own to learn the movements. Talking too much and giving too many verbal instructions can be confusing and takes the focus away on simply trying to make big movements. Try to use only very simple words like big hands, big posture, big reach, big step, stand up big. Now watch Jenny using simple phrases to help Bob move his best.
Big reach, down big, up big, and back big. Good, big posture, Bob.
After you give a cue or instruction, be patient. Give the person time to process your request and react. If you give even more instructions or cues too soon, again, it can be confusing and counterproductive. You may be surprised at the abilities of the person you are caring for when you simply wait for their effort. If the persons you are helping are having a hard time following the exercises with what you are saying, just show them how to do it or do the exercises with them.
So we're going to get our legs out nice and wide again. Good, and we're going to start here with big posture. Now you watch me on the first one, okay? We're going to do a big twist all the way around, and then we're going to come back and finish big.
Okay.
Are you ready?
I think so.
All right.
We all know it is not easy to exercise every day. And for people with Parkinson's, this is even more true. The positive words you use to encourage and motivate are valuable. There may be times when the movement or exercise is not perfect, but don't be discouraged. People with Parkinson's have great potential to move better with your help and encouragement to do their exercises every day.
Big step and finish big. Very nice. Good job.
Thanks.
All right, one more. Big reach. Big hands, down big, up big, back big, And hold. And how about you count us out this time?
2, 3, 4, 5, 6, 7, 8, 9, 10,
And big finish. Nice job.
Thank you.
Good use of your nice loud voice. Okay, Bob, we're going to do our big sit to stand. Are you ready?
I'm ready.
Okay, we're going to do a big reach and up. Okay, back big, and go again, even more. Big reach, get way out there. And up big. Good job, I knew you could do it. Nice job. Now back forward and sit down. Great job.
We recommend that the exercises are practiced during a time of day when medications are working their best. This is not the only time to move big, but moving big is easier when medications are working their best. Ideally, schedule a regular practice session to help form a habit of regular exercise practice, just as one takes their medication at certain times of the day. When a person receives LSVT BIG, he or she practices using big movements throughout an entire activity, such as dressing, brushing teeth, getting in and out of bed, and moving from one room to another, for example. We recommend that these tasks continue to be practiced daily, just as they were in therapy. Simply doing the LSVT BIG exercises is not enough. The maximal daily exercises are just a tool to facilitate better, bigger movements in everyday life. Please remind the person you are helping to always think big and use bigger movements with everything they do.
Hey, Princess, how are you?
I'm well, Dad. How'd you do in therapy?
Oh, they really worked me hard today, but I think it was good.
I'm glad to hear it.
Thanks.
Let's get you out of here and we'll get
Okay.
some lunch. You're having trouble. Why don't you use the big techniques they just taught you?
Of course.
Well done, Dad. Let's get you out of here.
So where are we off to?
I don't know. Where would you like to go for lunch?
Oh, someplace really expensive.
Excellent. We'll put it on Mom's charge card.
That's a very excellent idea.
Okay, so hopefully you were able to see that video just fine. If not, this webinar will be recorded, as Beth said, and you can fast forward, I believe, to that section so that you can see the video. And again, this is a section that's part of the Homework Helper video, volume 2 as well. So let's talk a little bit more about the homework on the next slide. The home routine is really, really critical. And by the end of 1 month of LSVT BIG, they should have an established homework routine that they can continue and they will continue on their own. So we want them to get to the point where they really value and know the importance of continuing with that exercise on their own every day. And that homework will actually be discussed during the assessment so that the person can make a decision for themselves. Or am I up to this right now? Or do I need to, think about this and revisit this a little bit later? If the homework routine is not followed, the therapist will assist with finding solutions or discussing alternative interventions. But we found from our experience that it doesn't really pay to continue and do all 4 weeks of the protocol with a client who's just not invested in doing their homework every day, because the treatment results won't be as lasting or as robust as they would be if they had been more adherent with their homework. So the good news is that it's not a lot of minutes spent every day during homework. On the next slide, you'll see that for LSVT LOUD, it's really only 5 to 10 minutes once a day on the days that you would come to treatment, so those 4 days a week, and 15 to 20 minutes twice a day on the non-treatment days. So not a huge time investment. For LSVT BIG, it's 15 to 20 minutes, one other time a day on treatment days, and about 15 to 20 minutes twice a day on the non-treatment days. And then lifelong, after that 4 weeks is over, it's 15 to 20 minutes a day, once a day, forever. So we say, just like you take your pills, you take your exercises. Here's what's entailed in the homework assignments for both LSVT LOUD and LSVT BIG. So for LSVT LOUD, they do all of those daily exercises, the long ahs, the highs and lows, and the functional phrases, in addition to the speech hierarchy exercises and carryover assignments. For LSVT BIG, it's a minimum of 4 repetitions of all 7 of the exercises, 5 repetitions each of all the 5 functional component tasks, some big walking, and carryover assignment as well. We do emphasize that the homework is not optional, it's mandatory because we know that it's a key for long-term success. And our goal is to really help that person optimize treatment so that they can really reap the rewards of success with better speech and better movement. So we say to our patients, after treatment, take your daily dose of LSVT homework exercises. So just as you take your medicine and you take your daily dose of LSVT LOUD and LSVT BIG exercises, and that's really the best combination for long-term success. To help support that, we have postgraduate groups that we have developed. These are relatively new, so they're not in every community, but they're growing and in many communities. We have LOUD for Life for people that have completed the full LSVT LOUD protocol, and BIG for Life for people that have completed the full LSVT BIG protocol. And if you're a person who has completed both treatments, then you would be eligible to join both groups. They're really fun, and they are an opportunity to practice exercises, practice your improved voice and movement in function with a group of individuals just like you who've also received treatment. So it's fun, it's socially engaging, it's a great way to stay motivated with your exercise practice. It's pretty easy to find a class. Go to our website just as if you were finding a clinician. So remember, there's that big orange button that says Find LSVT Clinicians. Select your desired provider type. So it's a separate search for LSVT LOUD and LSVT BIG. Type in your location information. Usually city and state is best if you're in the United States, or city and country if you're outside of the United States. Choose your search radius and then scroll through the listings and look for someone that has this additional designation of a LOUD for Life provider or a BIG for Life provider. So they have gone through an advanced training course to know how to lead these groups. These are billed as cash. They're usually a small nominal fee. Some of them there's no fee, where you can join for an hour session, typically once, maybe sometimes twice a week. All right. There are some other ways that caregivers can help with the homework. For individuals who need a little bit more help, maybe the Parkinson's is a bit more advanced, think about what's the time and place that's really ideal for doing the exercises at home. So timing in terms of medication and energy level, looking at the place in terms of where's a place that I can move big and do it safely where there's no distractions. They might need some help with setup, like getting a chair, loading the homework helper DVD if you're going to use that, setting up the companion. Some people simply just need reminders because they forget. Hey, did you do your exercises? Nope, I'm going to do that right now. And then check on their homework every day. You can even jot down a note on the log so the therapist knows how you helped or any observations that you made. If you do go to therapy, you can ask or observe what the patient did in therapy so you can know how to continue to help or some things that they really need to focus on. And learn how to cue or coach if necessary. Like I said in the previous slide, you might need to attend a few therapy sessions with them so you can learn how to be the best coach that you can be. If you need to provide help with finding an LOUD for Life or BIG for Life class, that's always useful as well. So we know that we've talked a lot about things that caregivers can do to help individuals going through the LSVT programs, but we also know that it's not easy for you. It's exhausting. There's a high level of burnout. There can be frustration, and sometimes you just need a break as well. So here's some things that we've added on for you. Really work with a clinician to know when do I really need to cue, so you feel like you're not cueing 24/7 with your loved one. What are some key words I can use when cueing? Are there some signs or reminders to think loud or to think big that I can put around the house so that I'm not doing so much verbal cueing? Is there some respite care that you can find? Are there friends and family members that can help with appointments, with transportation, setting up Zoom calls, Zoom meetings, etc., for your loved one? Know that there's support groups for care partners as well, not just the person with Parkinson's. So take time for self-care as much as you can. It's not easy, but it is so, so important. On the next two slides, we've listed some recommended resources. And remember, you can print the handout in your control panel so that you have these. But you can see that the main Parkinson's organizations like the Parkinson Foundation, the APDA, the World Parkinson Coalition, the Davis Phinney Foundation, and the Michael J. Fox Foundation all have information specific for care partners. And there's actually a care partner virtual panel coming up soon through the World Parkinson Coalition. On the next slide, there's some additional resources and links that you can see. There's an online support group for caregivers that is put out by the Parkinson and Movement Disorder Alliance. There's also caregiver action networks. There's an Alliance for Caregiving and other care partner resources listed here. So it's a lot of information, but know that there is support and help out there too for caregivers. If you're interested in learning more about the LSVT programs, certainly check out our blog and our website. There's a lot of information specific for patients and families that you can learn basic and more advanced information as well. We also have social media. If you're into that, we have all the major platforms. And if you have a specific question, email us at info@lsvtglobal.com. So in summary, just know that Parkinson's is more than a motor disorder. Those non-motor symptoms are sometimes not visible, right? But they're real. And those sensory changes and internal cueing deficits are important for care partners to understand so you can empathize with why it's so difficult for the person with Parkinson's to speak louder or move bigger. The LSVT protocols in particular are evidence-based and created specifically for people with PD, and care partners can help to optimize communication and movement to ensure that the person is receiving LSVT LOUD and LSVT BIG by a certified clinician. You can also help to play a helpful role at home to ensure success of the recommendations and homework assignments that are provided to the person going through treatment. And we recognize that caregivers can be exhausted and suffer from burnout, even though it has rewards as well. So be sure to take time for yourself and seek support from others that maybe understand or can be empathetic and help you as well. Now, our next webinar, which we would love for you to join, is really looking at these Parkinson's organizations within our community. We're going to have featured guest speakers from a number of different Parkinson's organizations so you can hear what they offer. And I think for both patients and caregivers and therapists, this will be a really useful webinar. It'll be a 90-minute webinar because we have more speakers than we normally do. All right, in these last few minutes, Beth and I are going to hang on and allow you to ask questions. I know that some of you have already submitted questions that she and I will both do our best to answer as many as possible. The easiest way for us to answer your question is if you type it into the question box in your control panel. However, you can raise your hand. If you do that, we'll call out your name. Make sure that your microphone is unmuted so that you can ask your question out loud. And if we run out of time or you think of something later, you can always email us as well. So I'm going to turn the mic back over to Beth and maybe we can kick it off with some questions.
All right, great. Thanks so much, Laura. So we had some great questions come through so far during the webinar. I'll take the first one about LSVT LOUD. So this question is, in LSVT LOUD, how do you apply the core amplitude rescaling exercises such as the AW to the hierarchy exercises? So those core amplitude rescaling exercises, so the AW, the high and low, and the functional phrases are really the building blocks or the warm-up to get the loud voice kind of revved up. And so once we have that loud voice revved up, then we translate it into the hierarchy exercises. So we're using that loud voice now in week 1 for words and phrases, progressing to sentence level, paragraph reading level, all the way into conversation. So an example that you can think of during treatment, if we have a patient, they have this nice loud ah voice in the first half of the session, and then we move on to the hierarchy in the second half, and maybe they say something like, "What's for dinner?" and they drop all their volume. I might say to them, let's get that ah voice and let's do ah, what's for dinner? So it's a way to get that loud voice and the whole really voice motor system warmed up and revved up to get that feeling of the louder voice, so that they'll now take that loud voice, not just use it for the ah, but they'll have that same feeling that they did for the ah, but they'll use it in everyday speaking by the end of treatment. So again, in week 1, we're just at that word and short phrase level. So we're using that same ah loudness for the hierarchy exercises. And anytime we hear the volume drop in the hierarchy exercises, we might refer back to that ah and say, I want you to feel just like you did for the ah. Every word you say, I want it to be that same loudness, that same effort that you did for the ah. So it's really translating those building blocks into, by the end of treatment, everyday conversation. Okay, the next one. So when you inquire, what are your typical outcomes? And I think that was a slide that Laura was talking about when you're trying to find treatment for your loved one. So when you're asking about typical outcomes, is it more related to the motivation offered by the therapist, or is it some flaw in how the sessions are administered? Maybe not paying attention enough or something like that. So really, when we're looking at what are your typical outcomes, we really want to make sure that the therapist is, first of all, providing the treatment, the gold standard treatment, just as Laura mentioned. So the 4 days a week for 4 weeks, individual 1-hour sessions. So oftentimes, if we're seeing outcomes that aren't great in terms of, overall meeting goals or improvements in movements or louder voice, it can be because they weren't following the protocol. So maybe they didn't do 4 days a week. Maybe they just did 2 days a week, or the sessions weren't 60 minutes, or they were group sessions. So we're really making sure that the therapist is delivering gold standard LSVT LOUD or LSVT BIG. So I think that addresses your question. I don't know, Laura, if you had anything to add to that.
Yeah, no, I think that's the same, Beth. We know from the research studies of the last 30 years that when this treatment is used for idiopathic Parkinson's disease, it's consistently effective. If the patient does their homework and the therapist does what they're supposed to do, it's effective. And so you'd hope to find a therapist that says, well, gosh, I've had great success. Here's a few examples, give you some details to give you some confidence that this therapist really has experience and has had successful outcomes as they should.
All right, great. Thanks, Laura. And before this next question, I also just want to let everyone know that we did reach our hour. So if you were on and you wanted to get a certificate, you can close out of the webinar, and we know you've been on for an hour, but we will continue to stay on for 10 or so more minutes to address the other questions. So Laura, if you want to take this next one, if the disease is eroding movement and speech all the time, how can the training outpace the erosion?
Yeah, that's a good example. That's a good question. So, LSVT LOUD and LSVT BIG are not cures for Parkinson's disease. However, what we do see is that we can improve movements, sometimes even to, how they were moving or speaking years ago, sometimes to baseline normal levels of how they should be moving with for a person their age, or for how they should be speaking for a person their age as well. And so that's exciting for us to say, man, can we really slow down the symptom progression of Parkinson's disease, even if the underlying pathology continues to progress? Can we slow down that deterioration in speech and movement? So it'd be great to have some longitudinal studies. So far, our studies are at 2 years out for LSVT LOUD, where sound pressure level was by and large maintained over that time. Beth, is there anything else you want to add to that from a speech perspective?
No, I think you did a great job answering it. So thank you. Okay, and this is another one related to LSVT BIG, or the movements. So this is in relation to the video. So Laura, if you can take this one. So it says, poor Bob had his feet planted further from the chair than the therapist did. Would you cue to have him move his feet in a couple inches, as long as his knees and hips don't prevent it?
Yeah, that's a great observation. And I wonder, you might be a therapist yourself. So, so kind of what we do in LSVT Big is different than how you would train someone in normal traditional therapy. So in traditional therapy, you would say, Bob, you need to get your feet underneath you. You need to scoot forward a couple inches. You need to lean forward as much as I do. You need to really use big effort when you stand up, but it's really different in LSVT Big. We simply say, I want you to, position your body like I am and do what I do. And it's very effective. And if the patient isn't doing something quite right, like they don't have their feet far enough back like Bob did, we do two things. We say, look at my feet, make your feet like mine, right? Where are my feet? Make your feet like mine. The other thing is we let our patients problem solve on their own. So if Bob wasn't successful in getting up on that first try, instead of jumping in and telling him, hey, Bob, get your feet back, we might say, Bob, what can you do next time so that you're successful in getting out of this chair in the first try? And that really engages his brain in a whole new level of problem solving. And if he can figure it out through a little trial and error, that is going to stick, so that I'm not going to be the repetitive therapist that says every single time, get your feet back, get your feet back. All right, I think we can go on to the next question.
Okay, so the next one, how do you do the high and low ah? So with the high and low ah, this would be one of the daily exercises. The patient would start with the same loud ah that they did for the first exercise. So that would be ah, and then they're either going to go high or low. So the high might sound something like this. Ah. So they're keeping up the same loudness, same voice quality all the way when they get to that highest ah. And then they would do 15 of those repetitions, and then they would do 15 low repetitions. So again, the patient would start at that same ah, where we say that's your modal or your speaking pitch ah. So ah, and then they're gonna go low in pitch. So it will sound something like this. Ah, and keeping that same loudness. With the first exercise where they're doing the long, loud ah, we have patients do that for as long as they can go, as long as they're maintaining that loudness and good quality. For the highs and the lows, patients only hold the highest ah and the lowest ah for a maximum of 5 seconds. And those can work on intonation. So that's what we're trying to, over time through treatment, expand that range of how high and how low they can go, while they're again maintaining that loudness and good quality. Okay, so the next one, Laura, if you want to take this one. So was some reduced medicine dosage with LSVT? So I think it's meaning, can patients take less medicine if they're doing LSVT either loud or big? And if the asker of that question wants to clarify, if I don't have it correct, feel free to type in another message, but that's how I'm interpreting it.
Okay, I got it. That's really a physician's call. Certainly the therapist has a lot of time spent observing that patient over 1 month, 17 hours in fact, if you count the evaluation, whereas a typical physician sees a patient for, maybe 15 to 20 minutes for an office visit every few months if they're lucky. So there are times when the therapist really has some observations that are important to share with the physician, such as, it appears that maybe this patient is underdosed, or sometimes the patient has struggling with dyskinesias greatly because of their high medication dosages, and is able to have a conversation with the physician to say, could the patient try a lesser dosage so that maybe they have less dyskinesias? We're working on the ability to override hypokinesia through LSVT Big. But that's a very individualized conversation for each person. Certainly, we haven't done any research studies to say that people can reduce their medication dosage because of LSVT.
Great, thanks, Laura. And it looks like we have one more question. So can LSVT Loud help patients with other voice disorders as well? And yes, there has been research to show that LSVT Loud can be applied successfully to other disorders. Some examples are multiple sclerosis, individuals post-stroke, cerebral palsy, Down syndrome. Those are some of the ones that have been studied with research. We don't have the wealth of data on other populations like we do for Parkinson's. So we can pretty confidently say if someone has idiopathic Parkinson's, stage 1 through 3, we know that this treatment will work really well for them. For these other populations, it's more of kind of testing it out. So when we train clinicians in this treatment, we have them do what we call stimulability testing with these patients with other disorders to see if the techniques that we're going to work on in treatment, such as, again, the focus mainly on the louder voice, if the patient gets louder and follows the cues and models from the clinician, are we seeing improvements in their voice and speech? Because some of these other disorders, the main kind of deficit might not be loudness, but we might see that focusing on loudness can kind of help the whole speech production system. And so it might be a good, what we would call like an entry point into helping overall communication. So we have clinicians do that stimulability testing to see when I model, when I cue for loudness, am I seeing improvements in overall communication? And if so, then we would progress with treatment and do what we would call a 1-week trial of treatment to see how they do during that week when they have 4 sessions, full hours, individual treatment. If they're doing well that week, we would continue and go for all 16 sessions. So if you are interested in learning more about the other populations that LSVT LOUD has been applied to, there's a webinar that we did. So if you went to our website, that blog.lsvtglobal.com, and looked at the on-demand webinars, there's the one that I can't remember if the title was Beyond Parkinson's or LSVT LOUD applied to disorders other than Parkinson's, but something like that. And there's a whole webinar on it. There's also, you can look at the research articles, and there's a section in the research articles that show all the other populations that have been studied with LSVT LOUD. So the studies, the research that's been done for those other populations. So you can see what all populations have been studied. Okay, and it looks like we've addressed all the questions that came in during the webinar. If you do have a question, again, feel free to email us after the webinar, info@lsvtglobal.com, if other questions come up, and we're happy to address those. So we want to say thank you. We appreciate you joining us here today, and we would love to see you again on a future webinar or joining in on one of our on-demand webinars.
Thank you.